Thank you. And thank you so much to the Osher Center for inviting me to take part in this critical conversation. The integrated medicine community represents a range of medical specialties and academic disciplines. But I suspect all of you felt called to work in health for the same fundamental reasons I did: for people, to protect them, to treat them, to heal them, to help them live healthier, longer lives. Yet in many ways, the gap between the ideals that first called us all to this field and the reality confronting our healthcare workforce is widening every day. And it is leading to a dangerous epidemic of burnout on the front lines. Burnout, it's an issue that has been impossible to ignore these last 8 months. To date, the COVID-19 pandemic has left more than 220,000 Americans dead. It has upended the lives of millions more, and it's killing our healthcare workforce, and not just by making them sick. Some of you may have probably heard of the story of Dr. Lorna Breen. Dr. Breen was the director of the emergency department at New York Presbyterian Allen Hospital in Upper Manhattan, a part of the city that was hit particularly hard at the beginning of the pandemic. In those terrifying early weeks, Dr. Breen treated patient after patient in multiple emergency rooms, and in doing so, she even contracted the coronavirus herself. And as soon as she was able to get back to work, she rushed back because she knew how badly her skills and her expertise were needed. Like so many other doctors, nurses, and EMTs, Dr. Breen faced enormous challenges in her daily work. A scarcity of PPE and oxygen supplies, 12-hour shifts spent on her feet, unimaginable amount of time watching what she described as the onslaught of patients, some of whom died in the ambulance or in the hospital lobby before they could get help. But through it all, Dr. Breen never once complained. She didn't ask for time off, and she didn't seek the mental health support she needed. She didn't seek that support for fear of what it might do to her career and her reputation. Ultimately, it all proved too much, and in April, Dr. Breen died by suicide. Dr. Breen's tragic death underscores a secondary public health crisis that is unfolding in hospitals and EMS stations across the country. The novel coronavirus is ravaging the well-being of our frontline healthcare workforce. I can't keep but think of the heartbreaking video that made the rounds on social media back in March. It was posted by Danelle Schmall, a nurse who traveled to New York City from Washington, D.C. to help at the start of the pandemic when the city's health system was, quite frankly, overwhelmed. In the video, Danelle was seen sobbing uncontrollably as she talks about what she's experiencing every day. I don't think anyone understands how stressful this job is, she says. I wouldn't trade it for anything in the world, but it's so stressful. She talks about the exhaustion of walking into rooms and discovering dead bodies, of calling families to tell them their loved ones are gone. And she describes how she cries on her way home from work, overwhelmed by the trauma she's witnessing, shift after shift after shift. She says she doesn't think people understand that healthcare workers are not immune to despair, that they are human, just like everyone else. And she says something that I think is so poignant. I will quote her. Everyone is really concerned about the patient, and that I understand. But if your staff is not doing well, then who is going to take care of your patients? That's the question we all need to ask ourselves. We don't yet know the true toll this crisis will take on our healthcare workforce in the long run. We are still in a way away from having the data we need to fully assess this toll. But we do know that physician suicide was already a daily occurrence before the pandemic began, much higher than that of the general population. And quite frankly, stories like Dr. Breen's and Nurse Small's speaks volumes about what we as a country are now asking of our healthcare workers. In too many cases, the answer is we are asking far too much. Even under normal circumstances, the people who so dutifully care for us have struggled to get care for themselves. And an alarming number suffer from burnout, and they suffer from burnout in silence. This burnout manifests in many ways. First comes emotional exhaustion, feeling drained mentally and physically, and being unable to recharge when they're off the clock. Imagine being drained physically and mentally and being unable to recharge even when one is off the clock and should be resting. Second is depersonalization. That is starting to develop a negative or even cynical outlook about the work. And third is a reduced sense of personal accomplishment, feeling incompetent or ineffective, or questioning the very value and meaning of what they do. Prior to the pandemic, research showed that more than 3/4, actually 78% of physicians have experienced these burnout symptoms. Now they're being asked to shoulder additional once-in-a-lifetime burdens during this pandemic. And in addition to the long hours on the clock and the mountains of paperwork after hours, there's the staggering volumes of patients, the grieving family members in need of comfort, the heightened risk of getting sick themselves. This is to say nothing of the stress they face outside of work by simply living through these unprecedented, uncertain times. Unfortunately, there's no clear end in sight, and the consequences of our workers and our healthcare systems will be devastating. Burnout doesn't just hurt doctors. It ultimately hurts the people they care for. It is shown to lead to lower patient satisfaction and increased medical errors. Just as troubling burnout causes doctors to scale back their work hours or leave the profession altogether. A recent Mayo Clinic study sought to quantify the impact of burnout on physician attrition by asking doctors to report their level of burnout on a 7-point scale over time. The investigators found that for every 1-point increase in reported burnout, physicians were 30 to 40% more likely to reduce their hours within 2 years. When you take that information and others that have been published together, what we see is that there's an equivalent of losing the graduates of 7 medical schools every year. That's a disaster in the making. The US Department of Health and Human Services has predicted a shortage of up to 90,000 physicians by the year 2025. And the toll of this pandemic could cause that number to rise even higher. Recruiting and replacing each of these doctors that we would lose will cost somewhere between $500,000 and $1 million. Globally, a shortfall of this magnitude could impede our ability to build an adequate healthcare workforce that is designed to meet the Sustainable Development Goals. The attrition would contribute disproportionately to hurting low-income countries and could contribute to the loss of countless more lives. So there's no question, this is yet another public health crisis unfolding right before our eyes. And the real question is, what can be done to stem this tide? Fortunately, quite a bit can be done. In the immediate term, we have to support our health workforce in prioritizing their own well-being during the current public health crisis and beyond. That is the aim of the First Responders First initiative, an initiative started by the Harvard Chan School of Public Health in partnership with Thrive Global and Creative Artists Agency Foundation. Our goal is to provide a range of resources to those on the front line, from PPE to childcare assistance, to evidence-based workshops, to mental health services that will help providers build resilience and better care for themselves. In other words, we're taking a whole human approach to supporting these workers and their families. By promoting self-care alone, we will not address the entire scope of the problem. We also need a cultural shift. We have to support proactive and confidential mental health treatment for health workers on a systematic level. That means not only improving access to resources, but also addressing the stigma associated with mental health care. Right now, so many of our frontline workers would benefit from professional support, yet they're deterred from seeking it for fear of social and professional repercussions. And that fear is valid. From medical school through residency and practice, our field has an unspoken mantra: never show weakness. In fact, it's codified in rules and regulations. Today, many medical boards across the country still require physicians to report any past mental health diagnosis or treatment. The Federation of State Medical Boards has recommended against this and called for state licensing boards to refrain from asking probing questions about mental health, addiction, or substance use. Instead, they should focus on questions about whether physicians can practice medicine safely. Because any health condition, whether it's physical or mental, is only relevant for licensure if it impairs a physician's ability to deliver competent care to patients. State boards must heed these recommendations and remove the barriers to mental health care. At the same time, health systems need to make that care an organizational priority. That means adequately staffing emergency rooms and ICUs so that individual workers are able to take much needed breaks. It means institutionalizing wellness training that emphasizes nutrition, exercise, and stress management so that employees are better equipped to handle the strain of working in an intensive hospital setting. And it means cutting down on the additional burdens that providers are saddled with outside of patient care. To that end, we have to improve the usability of electronic health records, which prior to the pandemic, physicians called the single greatest pain point in their practice. Typically, for every hours physician spends with their patients, they're spending another 2 hours doing computer work. And much of it is done outside of the work hours, cutting into what little time they have to recharge. That's in part because there are more than 700 EHR systems in use today. A lot of them are clunky, prone to glitches, and worse, incompatible with one another. Healthcare providers are spending hours clicking away through drop-down boxes and typing snippets of patient information into fields in order to meet all of the onerous documentation requirements. And even still, they routinely have to send that information to other providers via fax or CD-ROM. I mean, think about it. When's the last time you used either of those technologies, fax machine or CD-ROM? The good news is we have some major opportunities for improvement on this front. User-friendly mobile apps can make it far easier for records to be shared across EHR systems. And they could help streamline some of the more cumbersome processes like prior authorization and patient referrals. Artificial intelligence has the potential to reduce the burden of documentation. But no matter what tools are introduced, it's imperative that physicians themselves are consulted in the development and the design of these processes. All this is to say that creating a culture of wellness requires both technical and human-centric adaptive solutions. And I know that that is a tall order. To facilitate these changes, it's imperative that every major healthcare organization appoint a wellness officer. This executive could be tasked with studying burnout across their organization and be a leader in implementing strategies like the ones I've just mentioned. It will pay dividends for both patients and the providers in the long run. In 2017, Stanford Medicine appointed Dr. Tate Shannenfeld as the country's first ever chief wellness officer. tasking him with combating physician burnout. And what exactly did he do? From day one, Dr. Shannenfeld and his team took charge, collaborating with other executives to collect data on things like how much time physicians spent doing paperwork or working after hours, and building camaraderie through group dinners and a robust peer support program. Today, these efforts have already begun to make a difference. More than a third of all departments have experienced dramatic improvement, and across the board, fewer burnout symptoms are being reported. We hope that other organizations will follow suit, and that together they'll create a community of leaders who can share successful strategies for promoting wellness across the health system. That will go a long way to alleviate some of the burdens our clinicians are facing. And most importantly, it will signal that they are not alone, that their burden of exhaustion, anxiety, or depression is one shared by many of their colleagues, and that it's not a personal failing, but a systemic one. Admitting fatigue, asking for help, or simply taking a break to recharge or cope with loss is actually a courageous act, and it should be extolled, not condemned. Fortunately, there are signs of progress on this front. For example, Dr. Lorna Breen's story has moved so many across the country, and the foundation, started in her honor, has attracted thousands of people to help promote the well-being of all healthcare providers. Congress even introduced the Dr. Lorna Breen Healthcare Provider Protection Act, an act to bring effective, evidence-based mental health resources to healthcare providers. And thanks to her story and thousands of others, the entire healthcare community is starting to have a long overdue conversation about the expectations we put on our healthcare providers and the expectations each of them puts on themselves. Changing these expectations will take cooperation from many stakeholders. That includes state medical boards, which must change the medical licensing processes to reduce the stigma that comes from seeking help. It includes state and federal agencies who must determine which measurement requirements actually serve the goals of patient care and eliminate the ones that don't. Insurance companies will need to do the same for their documentation requirements. They'll need to streamline their cumbersome pre-authorization processes, which study after study shows that these processes create significant administrative burdens and takes time from patients. For their part, EHR vendors must ensure compatibility across their systems, and they must collaborate with healthcare providers to make sure these systems are user-friendly. And it will require healthcare organizations from medical schools to hospitals to recognize burnout for the pervasive problem that it is, and to make addressing burnout an organizational priority. All of us have a role to play too. Each one of us must remain vocal and honest about what we are witnessing and experiencing on the ground every day, in our hospitals, in our laboratories, in our classrooms, and even within ourselves. It's not something we can afford to ignore anymore. It's up to us, each and every one of us, to keep raising these issues and to keep pushing for critical reform at the state and federal level so that our healthcare workforce can do the work they got into this profession for, and that is to help people. The good news is that we are now poised to do exactly that. I keep thinking back to an article I read in last month's Atlantic by George Parker. He quotes the philosopher Gershom Scholem, who said, "There are in history what you could call plastic hours, namely crucial moments when it is possible to act. If you move, then something happens." In other words, it takes the right alignment of public support, political will, and urgent circumstances, the kinds we are facing in this crisis. I believe we are living in a rare plastic hour, a plastic hour for public health. And we have to seize this moment, this hour. When the history of this pandemic is written, healthcare workers, from those working in hospices, to those in home care staff, to those physician assistants, to those EMTs, all will be remembered for meeting this moment with courage and compassion, often at significant personal costs. It's up to us to meet their heroism with the changes that they need and the changes that they deserve. I want to thank you all for being partners in leading that change. Thank you for your time, for your attention, and for caring and working on behalf of people.